Hi, my name is Emily Streit, and I am a physical therapist here at Ozarks Healthcare in our outpatient facility in West Plains. I wanted to talk to you today about a treatment that we offer called trigger point dry needling. I personally have been certified in dry needling for the past 5 years, and I found it to be really successful with a variety of my patients. So today we're going to talk about what it is, some commonly asked questions, and we're also going to do a little bit of a demonstration so you can get a good visual of what the procedure looks like. So what is trigger point dry needling? Trigger point dry needling uses an extremely fine needle to target contracture knots or trigger points within the muscle. It's called dry needling because nothing is injected in the needle, it's just the needle itself. And the goal of it is to get this localized twitch response within the muscle that releases muscle tension and then decreases pain. The other thing that happens is around those trigger points is a buildup of neuropeptides and neurotransmitters that are responsible for pain and inflammation. And so they find that after that twitch response happens, there's a decrease in the concentration of those substances. So this means that there can be a more lasting effect on that reduction in pain. Trigger point dry needling has actually been around for quite a while, several decades in fact, and has been used by mostly physicians, but it's increased in popularity as more chiropractics and physical therapists get certified in it. So why does it matter to target these trigger points? Like we mentioned, they can cause pain, they can restrict muscle function, how well it lengthens and contracts, and they also can develop in areas of repetitive stress. So areas where we hold a lot of tension, where the muscle is taking a load more than it can sustain. And so they become problematic in a patient's long-term pain. The other thing that they can do is they can actually refer pain to adjacent areas of the body. So commonly, trigger points in your neck and shoulders can refer pain into the head, so a source of headaches, or a trigger point in the hip can refer pain down the leg. So it's something that we want to address. So some of the common questions I get, the big one is, how is trigger point different from acupuncture? So both use that same really fine needle to help decrease patients' pain. However, they differ in terms of where the needle placement is, the methodology, and then the philosophy as well. So trigger point dry needling tends to be a more of a Western-based philosophy, and acupuncture is more Eastern-based. There is research to support both in terms of pain reduction, but trigger point dry needling is more targeted at those specific knots, whereas acupuncture is addressing pain more globally. Another big question I get is, does it hurt? So you will not feel that sharp prick of a needle when we think of a needle. It's more of a dull tap. But once the needle is addressing that trigger point and we're getting that twitch response, you will feel that, and it's kind of a strange sensation. So my patients describe it as, cramping or kind of a Charlie horse. Others describe it as really achy, like after you get a flu shot. The good news is the trigger point response is only about 10 to 15 seconds, so it is short-lived. But because you do get the release of some of those neurochemicals that we talked about earlier, there can be some lingering soreness afterwards. And so this usually lasts 12 to 48 hours, maybe a little bit less than that. But patients usually tell me their typical pain, what they're feeling day in, day out, is less after the needling. They just have that kind of soreness. So then what are the risks? There is a small risk for infection and bruising because it is an invasive procedure, but these are really minimal, and the therapist is taking precautions to minimize these risks further. In addition, if you were to get the needling, your therapist would screen you for any contraindications or precautions that would prohibit you from getting this procedure. So last question is, how do I know if this is right for me? So best way, just give me a call. Our number here is 417-257-5959. And I'd be happy to answer your questions, talk with you a little bit, see what's going on, and see if it would be something that you could benefit from. So a picture's worth 1,000 words. So we're gonna do a demonstration today so you can really see what the trigger point dry needling looks like. You'll probably be able to see the muscle response to it as well, and that will give you a better idea of what this is. So today, Kat has agreed to let me needle her upper trapezius. So this is this big muscle here. It's one I mentioned before, can be responsible for obviously shoulder tension, but also headaches. So a lot of this muscle can kind of refer to the side of the head into the eye. So it's definitely a problematic spot to have a trigger point. So we're just gonna clean off the area. Okay, so then we're kind of palpating to feel for where are those trigger points. So we're looking again for those contraction knots in the muscle. So quick little tap, kind of get that needle in. Did not hurt, right, Kat? No sharpness, okay. And there, you can kind of see twitch response. That's that involuntary contraction is what we want. And then I'm kind of feeling for, okay, when does that die down? Because that tells me that we've kind of released that particular trigger point, and I'm not feeling much there. So needle out. So again, that was, 5 to 10 seconds, pretty quick. So that's basically it. It's very quick, but it does provide a lot of relief for a lot of patients and really gets that muscle to release.